This is the most important thing about any type of dental marketing, and it'll help you save money, get more new patients, and it'll help you know how much you're supposed to be spending on marketing, whether it's Google ads or Facebook ads or news or postcards, whatever it is. So the most important thing is tracking what is going on. When you're thinking about marketing and spending money on marketing, you're investing in marketing and you're investing in getting more new patients. If you were going to get a new CBCT for your office, you would want to know how much more money you can make off of that investment. So if you figure that the new CBCT is going to cost you $2,000 a month, you would make sure that you're going to get more than $2,000 a month in either the cost that you're charging the patient for that CBCT or in the amount of implants or whatever that you're going to be able to do with that new machine. And if your friend came to you asking for investment money, you would want to make sure that you're going to get more money back than you're putting in. And it's the same thing with marketing. You need to make sure that your money is going to the right place, and you need to make sure that you're getting more back than you're putting in. To kind of help this make more sense, if you were paying $500 a month in Google ads and you weren't getting any new patients back, then you would be wasting $500 a month. If your ads were set up and you found that you could pay $1,000 for a full mouth of veneers patient, right? Every $1,000 you spent, someone came in who wanted upper and lower veneers, then you would pay $100,000 a month in marketing, right? You would get as many as you can, then you'd get associates in there to do the full mouths that you can't do, because for every $1,000 you're spending, you're getting $60,000, $80,000 worth of treatment out of it. So the most important thing is tracking what is going on, and this is how you do it. So you need to track every step of when you're doing paid advertising, you're first paying for the ad to be shown. So you need to track how many times that ad is being shown and who it's being shown to. And this you can do either within your Google Ads account or within your Facebook Ads account. Whatever account it is, you can do this within the software. Then you need to track how many of them are clicking on the ad. So that means they saw it. Did they like it? Is basically what that means. Did they like your ad enough to click on it? If that number is drastically different, then your ad probably needs to be improved, or you need to improve who's being shown your ad, right? Either you're showing it to the right people and they just don't like your ad enough to click on it, or you're not showing it to the right people because they're not interested in a dental office. The next thing you need to track is, are those people calling your office? So you'll either do this with a form, right? They either fill out a form that sends it to your office and that needs to be tracked, or you can do it with a phone number. So for all of these steps, you can always ask like ChatGPT and it'll tell you how to set this up yourself if you're running your own ads. And so if you're setting up a tracking number, it doesn't change your office's phone number, it just changes what they see. So if my phone number is all nines, right? 9999999. That's still my phone number. That's still the number I use. That's still the number that works. That's still the number that people see when I call out, right? When the office makes a phone call. But on your ads, you can put, say, all eights, right? 8888888. So that's what they see. So if they were to look at your ad and just type it in their phone, that's the number they're typing. And if they click on it from their phone or click on it online, that's the number it calls. But their phone call is still forwarded to your real phone number. So I'm not talking about changing your phone number, getting another phone line or anything like that. It's just a tracking number. And so there's companies out there that do this for very, very cheap. It costs maybe $10 a month for the entire software that will let you track it and record it and all of those things. And so then we'll know who's calling from those ads. Because if I'm getting 100 new patient phone calls a month, I don't necessarily know which one of those are because people like me and people have referred, or people just randomly saw my website online, or randomly drove by or did a bunch of research, versus how many of those people saw the ad. Because that's very important, right? If I'm getting 40 new patients a month and I'm very happy with that, they might be thinking that my ads are running well. When in reality, I just might have a good online presence and a good patient base, and I could not spend anything on ads and still get 40 new patients a month. So that needs to be tracked. And then we know from all of those trackings whether the ads are whether people are seeing the ads, whether they're clicking on them and liking the ads, and then whether they're calling the office. And then we need to know if they're actually scheduling. Because if those first 3 things are really good and they're not scheduling, then we're either not getting them in the office soon enough, or we're not handling that new patient phone call well enough. And then you need to look internally to see what things you need to improve. And with all of those in there, and then you can even track how much treatment you're doing for those new patients. If you add in that last step, you're getting a dollar amount for your ads. So if I'm spending $1,000 a month on ads, and through the end of that I got 10 new patients and $10,000 worth of treatment, then that means I made $10,000 for spending $1,000. And depending on the costs involved, right, if that is a good deal to you, then you might want to increase it so that you can get $20,000 by only paying $2,000, right? So your profit would be $9,000 and then $18,000 if you doubled it. And so this not only is crucial for knowing which part of your marketing isn't working or needs to be improved, it's also crucial to knowing that you're spending the right amount of money and knowing that you're not wasting any money. So for all of these little details, if you're running your ads yourself, just use ChatGPT and ask how to track those things, and it'll tell you how to set it up, it'll tell you how to monitor it, and it'll tell you which numbers are bad, right? You can figure out, like, I don't know, if 1,000 people are seeing my ad and only 100 are clicking, like, is that normal? It'll give you all of that stuff if you're trying to run your ads yourself. If you're not, and you're using a marketing company, the company should be giving you this data. You should still be knowing whether your money's being wasted, whether you should be spending more, whether it's a good investment, and where along the line it's breaking down. If you're just sending them $1,000 a month to do your marketing, and you don't know if your front desk is handling the phone calls right, or if your ads need to be improved, and you don't know anything about it, and they're not keeping you in the loop, the reason they're not keeping you in the loop is because they're not tracking it close enough. And so you need to find a new marketing company. But these things, this tracking alone, will increase the amount of new patients you get and make sure you're spending the right amount on marketing. If you want to get notified when more practice management tips come out, just subscribe. And if you want an online, full, comprehensive practice management course, I'll put a link in the description. And if you're having trouble finding a marketing company, I'll put a good one in the description as well. There are a ton of them out there that are good, and there's even more out there that aren't. So if you're using a marketing company, which is usually recommended because it does take a lot of time, you can do it yourself, but it is very time consuming to do it right. And there's a pretty big learning curve. So you absolutely can, and if you want to, I do recommend it. But if you're gonna use a marketing company, make sure that your money isn't being wasted, because it's very easy as a dentist to just not think of the $2,000 you're spending a month and assuming it's working, when you could be getting 3, 4, 5 times the amount of new patients for that money, or for even less. So it's a really important part of your office. So it should be tracked very well. for every step along the way so that you know where your money's going and you know if it's working and you know what needs to be improved.